You can do a lot of things in your life. You can do a lot of careers in your life. You can be in medicine in your life and not necessarily tie it to the why, right? My core identity is not as a doctor. My core identity is in Christ. My core identity is in my Christian faith. And because of that, God has called me to be a doctor. A big reason I love my job is the ability to navigate challenging, hard situations with my patients. There's this vulnerable time that they're in. How do I connect them to say like, hey, I'm gonna wade into this fight with you. I'm gonna wade into this what's going on with you. I'm not going anywhere, right? And I care about you enough that I want to see what the best thing is for you and to walk through this with you. And so earning that trust, not saying it's given, but earning that trust is a huge part of my practice. But the nature of what I do, a lot of it's done in academic settings. Acute leukemia care tends to be something that's relatively specialized and done in large academic settings or large hospital systems. It's been very cool to see that unfurl in these last 4.5, almost 5 years now, to see where my career has gone and where God has blessed us and entrenching us here in Eugene, and being able to provide something that's not available in a lot of community settings and be a conduit of my former colleagues at OHSU I worked with and providing care to people in my local community of where I grew up. There's a couple of things that really became paramount to me to want to give back and want to be able to provide. One of the big things was mentorship. Your journey is going to look different than mine. So I'm not saying do what I do, but these are the things that help me along the journey and they may help you. And then I think the financial aspect is that medical school is expensive. The process is expensive. It's a long haul. The scholarship that we're supporting now is a huge part of that, is providing both financial relief for the future, but also like mentorship and growth. My goal is that people who get this scholarship are, God's calling them to medicine and that they're successful, and this pushes them, spearheads them forward into a great career in medicine in the future.